In this video, we're going to be talking about the parts of a bone. So the bone is split into three parts. So the proximal epiphysis, the diaphysis, and the distal epiphysis. The way you can recognize the proximal and distal epiphysis is the proximal epiphysis is located more closer towards the center of the body rather than the distal epiphysis. So if you look at this chart over here, this isn't the anatomy of an entire bone. The outer layer is called the periosteum, and on the outer edges is cartilage. This is a soft tissue that allows us to move and rub our bones without any pain. So as we move deeper, we have the proximal and distal epiphysis as long as the diaphysis, just like I mentioned right here. So bone is divided into three parts. Now as we move more closer, we have, if we look at the ends, we have red bone marrow stored in both epiphyses. So what happens is the red bone marrow supplies us with red blood cells and white blood cells. The red blood cells provide oxygen and carbon dioxide to the body, while white blood cells provide the protection against any harmful viruses and bacteria. They also provide platelets. These platelets allow the blood to clot and to make sure that the blood won't flow more again. So like if you have a cut and if blood's coming out, the platelets will do their job and try to take all that blood in and make sure that it doesn't go out again. Now let's move more towards the middle. If we move towards the middle, we have the compact bone right under the periosteum. For these epiphyses, they have the spongy bone. The spongy bone is home to these spaces which allow arteries and veins to flow through. Now, in the compact bone, there is the medullary cavity, which is home to the yellow bone marrow. The yellow bone marrow provides storage for food and nutrients for the bone. However, in some situations, if you're experiencing humongous blood loss, then what can happen is the yellow blood marrow can turn into red blood marrow so that it can provide more blood cells to keep your body alive. And this is the red blood marrow right here. The top over here, we also have this small hole. This small hole provides an access point for the blood veins to go through the entire bone. And did you know the bone has a humongous network of a bunch of blood vessels and arteries? Now, something that was not shown here, but shown here, is the epiphyseal plate. The epiphyseal plate is it's like a guidance. It's a thing that allows doctors to see how much you're growing. So the more the epiphyseal plates, like the wider the epiphyseal plate moves, the more you're growing. So doctors can tell when you stop growing when the epiphyseal plate starts to fade away and turns into the epiphyseal line. Another bone anatomy, and I'm just gonna give a brief overview of what I just explained. So it's split into three. The bone's split into three parts: diaphysis and the proximal and distal epiphysis. But the epiphyses are home to there's also a cartilage and periosteum outside. The epiphyses are home to the blood marrow, the red blood marrow, as well as providing spaces for the veins to go through the hole. Along with this, they also have the epiphyseal plate, which tracks your growth throughout the years until eventually you stop growing. And in the middle, we have the medullary cavity. Then we have the yellow bone marrow, which provides storage and fat and nutrients for the bone. Along with that, there's the spongy bone located in the epiphysis and the compact bone located in the diaphysis. So it would be periosteum, compact bone, medullary cavity, yellow bone marrow. For the epiphysis, it would be periosteum, spongy bone, red bone marrow. Arteries that move through around the entire bone, like over here, here, and here. There are also many spaces and holes that allow arteries and blood vessels to move throughout the bone and through the bone. This is all about what's inside the bone and the bone anatomy.